Today, we will be discussing something almost everyone has experienced at some point in their lives, either by themselves or through someone they know: diabetes. Diabetes is a disease that alters how your body absorbs glucose, or as you probably know it, sugar. Glucose is the main source of energy for your cells, but to use it, you need a hormone called insulin. Insulin helps glucose get into your cells from your bloodstream. However, if you have diabetes, your body simply can't keep up with insulin production, or it can use it properly. This creates huge problems with your blood sugar levels and can threaten your life and well-being. There are two distinct forms that diabetes can take: type 1 and type 2. Type 1 diabetes is where your immune system disrupts the pancreas function by attacking its cells. Once this happens, they can no longer produce insulin effectively, if at all. As a result, you will need to manually inject insulin to compensate, or use a pump to help your body do its job. Type 1 diabetes typically manifests while you are young, but not always. Some people have developed type 1 diabetes well into adulthood. Type 2 diabetes is more prevalent and is often associated with obesity, a sedentary lifestyle, and an unhealthy diet. In this form, your body becomes almost inert when exposed to insulin, which can cause a lot of health problems. Type 2 develops in almost the opposite manner as type 1. It is far more common in adults, but can affect teenagers and kids as well. Diabetes can cause a lot of issues and can affect your nerves, kidneys, eyes, and heart. That is why controlling your blood sugar levels with medication, diet, exercise, and regular checkups is essential. However, some people may think that taking certain vitamins can help them with their diabetes, but this is not always the case. In fact, some vitamins can actually be harmful for people with diabetes. In this video, I'm going to tell you which vitamins you should avoid if you have diabetes and why. Remember that this video is for education purposes only, so always talk to your doctor before taking any new diet or supplement changes. To understand how diabetes affects the body, let's take a closer look at how glucose and insulin work. Glucose is energy for the cells in your body, but it can't enter them without insulin. Think of insulin as a ticket master that only lets the glucose into your cells with a proper ticket. As you consume food, your pancreas constantly distributes insulin into your blood, which then serves as the grand ticket master, giving glucose access to all your cells. This lowers your blood sugar levels and keeps it stabilized. However, if you have diabetes, something goes wrong with this process. In type 1 diabetes, your immune system gets confused and attacks your pancreas, severely affecting insulin production. This results in little to no insulin in your blood. This raises your blood sugar, which can be catastrophic to your body and the organs inside. In type 2 diabetes, insulin ceases to be as effective in your body, like a ticket master with no tickets. This causes your pancreas to produce more insulin, but it can't keep up with the demand over time. This likewise results in high blood sugar. As stated earlier, high blood sugar can affect many parts of your body. For example, high blood sugar can adversely affect your eye health, potentially leading to blindness. High blood sugar can also destroy the nerves in your feet and legs, causing pain and infections. High blood sugar can also elevate your chances of heart disease by causing inflammation and plaque buildup in your arteries. According to a review article published in the Diabetes Care, diabetes is associated with an increase in cardiovascular mortality and morbidity by up to 4 times. The article also states that diabetes is a major risk factor in chronic kidney disease and end-stage renal disease. Another article published in Diabetic Medicine reports that diabetes is the most common cause of non-trauma related limb amputations in the world. Diabetes is a lifelong struggle requiring close management. This management necessitates well-regulated blood sugar levels to prevent serious health issues from popping up. Treatment may include medication, insulin therapy, diet, exercise, self-monitoring, education, and support. Depending on the type and severity of your diabetes, diabetes, you may need to take oral drugs that lower your blood sugar levels or stimulate insulin production or action. You may also need to inject insulin or use an insulin pump to deliver it continuously under your skin. Diet and exercise are recommended for diabetes management. You should eat a diverse diet of protein, carbs, healthy fats, vitamins, and plenty of water. You should seek at least 2 hours of moderate exercise per week, such as brisk walking, cycling, swimming, or dancing. Physical activity can reduce your blood sugar, improve your insulin sensitivity, reduce your blood pressure, and prevent weight gain. Now that you know what diabetes is and how it affects your body, let's talk about the main topic of this video. You may think that taking vitamins can help you improve your health and prevent deficiencies, but some vitamins can actually be harmful to people with diabetes. In this video, we're going to tell you about 2 vitamins that you should avoid if you have diabetes and why. We're also going to give you some alternatives that are much better and far more safe. The first vitamin that you should avoid if you have diabetes is vitamin E. Vitamin E is a fat-soluble vitamin filled with antioxidants that helps protect your cells from damage. However, vitamin E can also interfere with your blood clotting and increase your bleeding risk, especially if you're taking blood-thinning medicine like aspirin. Vitamin E can also lower your blood sugar levels too much, which can cause hypoglycemia or a low blood sugar. Hypoglycemia can cause problems such as sweating, shivers, dizziness, hunger, and even seizures or coma. If you have diabetes, you don't need vitamin E supplements unless your doctor says otherwise. You can get enough vitamin E from your diet with foods such as nuts, green leafy veggies, and certain cereals. The recommended intake for vitamin E is about 15 milligrams per day for adults. If you do not take vitamin E supplements, make sure to monitor your blood sugar levels closely and follow your doctor's advice on the dosage and frequency. The second vitamin that you should stay away from if you have diabetes is niacin, a water-soluble vitamin. Niacin aids your body in making energy and supports your nervous system and skin health. However, niacin can also raise your blood sugar levels, which can worsen your diabetes control. Niacin can also cause side effects such as flushing, itching, nausea, liver damage, and gout. If you have diabetes, you don't need to take niacin supplements unless your doctor tells you to. You can get enough niacin from your diet by eating foods such as poultry, fish, meat, eggs, dairy products, whole grains, legumes, nuts, and seeds. The RDA for niacin is 16 mg per day for men and 14 mg per day for women. If you do take niacin supplements, make sure to monitor your blood sugar levels closely and follow your doctor's advice on the dosage and frequency. Instead of taking these vitamins that can harm your diabetes management, you should consider taking some supplements that can help lower your blood sugar levels and prevent complications. Some of these supplements are magnesium. Magnesium is a mineral that helps regulate your blood sugar levels and insulin sensitivity. Magnesium deficiency is more common than you might think and can often result in heart disease. Magnesium is plentiful in food like green vegetables, seeds, grains, and dark chocolate. The RDA for magnesium is 420 milligrams per day for men and 320 milligrams per day for women. If you take magnesium supplements, make sure to check with your doctor first and avoid taking more than 350 milligrams per day from supplements. Alpha lipoic acid. Alpha lipoic acid is an antioxidant that helps protect your cells from oxidative stress and inflammation. Alpha lipoic acid also reduces blood sugar and raises your sensitivity to insulin. Alpha lipoic acid is also effective against diabetic neuropathy. Alpha lipoic acid is rich in food like spinach, broccoli, tomatoes, potatoes, liver, and yeast. The recommended dose of alpha lipoic acid for diabetes is 600 to 1800 milligrams per day in divided doses. If you take an alpha lipoic acid supplements, make sure to check with your doctor first and monitor your blood sugar levels closely. Cinnamon. Cinnamon is a spice that has numerous antioxidant properties. Much like alpha lipoic acid, cinnamon is a powerhouse for building insulin sensitivity. Cinnamon can also lower your cholesterol. You can mix cinnamon into your food or drinks for a delicious dose of healthiness. For those with diabetes, it's recommended to take about 1 to 6 grams per day. If you take cinnamon supplements, make sure to check with your doctor first and monitor your blood sugar levels closely. These are some of the vitamins and supplements that you should avoid or consider if you have diabetes. Remember that supplements, while beneficial, should not be solely relied upon. You should always consult your doctor first before taking any supplements and follow their recommendations on how to manage your diabetes effectively. Thank you for watching this video, and we hope you learned something new today. Please like this video if you enjoyed it and subscribe to our channel for more health tips and advice.